Hi, I'm Josh McCurdy. I'm an occupational therapist at the Oregon Burn Center. As part of your burn and wound recovery, you may be asked to wear compression. Compression can come in many forms. Several of the forms will be demonstrated here. This is an ISOTONER glove. It has light stretch and can help protect the skin and prevent swelling. I'm going to place this on Viren's hand, making sure that it's tight and snug deep into the web spaces. In this case, if this person has injury to their forearm as well, they'll likely wear what we call tuba grip. Tuba grip is a tubular compression, and it is placed on various parts of the body. In this case, I'm going to place it here on his hand and forearm, just up to the elbow. It's important that it doesn't cross the elbow just slightly, because then it will likely roll down into the elbow crease itself. As you can see, there's no rolls or wrinkles. It's smooth throughout to help provide uniform, steady pressure to the various areas. This will be worn full-time. Full-time usually means about 23 hours a day. That allows the patient to have it off for the 1 hour per day for bathing, dressing, lotioning, and skin inspection. Another example, if a person had an injury to their hand, is custom fit compression. Now, custom fit compression would come as an outpatient. When you leave the hospital and come back to visit the doctor as an outpatient, the occupational therapist may assess your skin and see if custom fit compression would be helpful for you. As you can see, custom fit compression is not quite as stretchy as some of the compression that you initially leave the hospital with. It's tighter to push down onto the scar tissue to help reduce swelling and to reduce scar tissue buildup. It also provides a layer of protection for you to function in the outside world until your skin is durable and strong enough to serve as that outer layer of protection. Compression is worn to help reduce swelling and to reduce scar tissue buildup. It also serves as a layer of protection in the early stages of recovery from burn, skin grafts, and wounds. Sometimes a patient will wear ACE wraps early in their recovery process. This may include when a person first leaves the hospital and goes home. An ACE wrap is something that many people are familiar with, but often it can be put on wrong, so it's important to know that an ACE wrap must be put on in a fashion such that the pressure is smooth throughout to reduce the risk of skin injury. I'm going to demonstrate proper ACE wrap placement on our patient. Is that okay?
Yes.
All right. So as you can tell, I'm rolling it on at the same level as I pull. That assures that the compression is even throughout. I had mentioned tuba grip as a brand name of tubular compression that is often used. We also use another type of interim compression that is shaped. In this case, this compression is wider at the top and more narrow at the bottom. This often is used on upper extremities, arms, and legs, usually from the toes to the knees. As you can see, I've labeled this knee because it's wider at the top and more narrow for more compression at the foot region. It's important when putting this on that we protect the wound. The skin can be very fragile, and therefore we don't want to drag or slide the compression along the damaged area. As you can see, I folded it over onto itself and have it ready to put on with the correct manner to reduce injury to the skin. As I pull apart, I'm laying the compression down and preventing it from dragging. I'll now unfold that other layer and gently place right to the knee down to the toes, smoothing all areas to prevent any extra compression. This is a way to have the most pressure here, middle pressure here, and no pressure here to help reduce swelling in the entire leg. Often, when lower body injuries are involved, a patient is asked to wear compression for skin protection, scar reduction, and sometimes to help hold dressings in place when they're first ready to leave the hospital. Compression pants or compression shorts are an example of something that can be worn just like the other compression for full time, that is to say 23 hours a day. This is an example of compression pants. They're tight and should fit tight. It's important that a person has multiple pairs of lower body compression so that when they're done bathing, lotioning, and inspecting their skin, they have another pair of pants ready to put on to start the 23-hour clock over again.